TFM. Let's talk.
Welcome, ladies and gentlemen. There's Abbas with you from TFM, and with me, I have my special guest today, Mr. Alexandre Cunha, who is the board member of Oman International Hospital. Welcome to the show, sir.
Thank you, Abbas. Thank you so much.
So today we'll be talking about Oman International Hospital, of course, and how the aim of this hospital has been to provide state-of-the-art services and at the same time making it affordable. Which brings me to the question, and this has been running in my head since I came here, the premium bronze membership card that you've introduced.
Yes.
That caught my attention. Tell me more about this.
Okay. First, thank you for the opportunity to
Pleasure.
be here with you. Regarding the cards, well, when you have a facility like this, when you have a hospital that provides these kind of services with obviously very good human resources, excellent facilities, state-of-the-art equipment, most of the people immediately thinks that the services to be provided will be very expensive. This is the first
That's the
idea
impression I got.
that people
Because you have a spa.
Exactly.
So that's
you
what
even
comes
have
to your
you even
idea.
have a spa, but honestly, that's not exactly what we aim to communicate with people. The thing is, this hospital has agreements with all the insurance companies. So the people that owns an insurance, they can be treated inside this hospital like they can be treated in any other hospital.
Right.
At the same time, we consider that we need to give services, we need to provide services to the entire community. So knowing that a lot of people doesn't have an insurance, we came with the member cards. The member cards should be seen as a tool to guarantee that all the people will be able to come to the Oman International Hospital. That's the purpose of the membership cards. So obviously we have different levels of member cards.
Right.
And we start with a bronze card. This will allow to all its members to guarantee that they will have a special condition to come to the hospital. They will have benefits. It will be more affordable. Doing this, we are also guaranteeing that the entire community will benefit from the services that we are providing.
Right.
This is the aim. This is the aim of
And
the
are
cards.
there other categories apart from bronze? I mean,
Yes.
the first thing comes to my mind is silver and then
gold. Yes, those are the regular membership cards that people can get. Obviously, with different conditions regarding the segmentation of those cards.
Right.
But the aim is always the same: guarantee that we will provide the best healthcare services to the biggest amount of people that we can. So we don't want that. Or better, we want that no one can say that we don't go to the Oman International Hospital because we cannot afford.
Right.
This
right.
is exactly what we are trying to avoid. We need to guarantee that we are here to serve everybody.
And this has been mentioned a couple of times that even though when you enter the hospital, it gives you an instant feeling of luxury. But
is.
at the same time, you need to keep in mind that the aim of the hospital is to make it affordable. Whatever you see around
Exactly.
is supposed to be affordable. So that brings me to my next question, that Oman International Hospital has been working on an interesting project. Okay? And this is to do with the COVID testing.
Yes.
But it's a little different because at OIH, you're planning to conduct it in a drive-through format.
We have different approaches
Okay.
to test the community. As people must realize that the pandemic is not over yet.
Right.
We are still facing a considerable number of new cases. So we see the pandemic or the treatment of the not only the COVID patients, but also to guarantee that we will also avoid the spread of the disease as a mission.
Right.
Usually we say that in the healthcare field, all the healthcare providers must look at the pandemic as a mission. And knowing that we have these facilities, we have the capability to implement some flows that will allow us to test a lot of people, we will have a drive-through to test everyone that wants to be tested on a very simple way. People don't waste time. It will be very comfortable because people just come, they can drive. Our health professionals will be testing those people inside their own cars without leaving the
Oh
car.
wow! So the person will be seated in the
People
car.
will be seated. This is totally normal. It's a common procedure. It will increase the flow, so it will be very comfortable for all its users, and it's very convenient because it's simple and it will allow us to test much more people.
And I've heard this concern from people generally. They've been saying that they want to get vaccinated, but one of the reasons, I would say, not the main primary reason, but one of the reason has been going to the hospital. They've been concerned. There's a lot of anxiety and the unknown factor that, oh, if I go to the hospital.
Abbas, let me tell you, we tested in one single day more than 1,250 people inside this hospital.
Wow.
It's a remarkable number. We know that we can even increase this number. So we can, if we want, we can increase this number, which is remarkable. And when you perform a service like this, when you assume the responsibility to give the vaccine to more than 1,000 people in one single day, you need to guarantee to those people that they are inside a safe facility. So the flows, the circuits, the way that we do the triage, the way that we give the vaccine to each person, the way that we will surveil the 15, 20 minutes after the vaccine to each individual, it's part of our procedures. So just to have an idea, from those 1,250 people, we didn't have one single person with any problem related with the vaccine, which is great. And this doesn't mean that some people can have those common side effects that are usual, not only to this specific vaccine, but also to several other types of vaccines. So
Right.
people must realize that the vaccination is almost an obligation. It's safe. It will help us all to reach this goal to guarantee the immunization of the population.
And that brings me to this vaccination drive question, that what is the time frame that's involved? How many patients is Oman International Hospital planning to vaccinate? The number of vaccines?
Yes, as you know, presently to access the vaccination, companies must apply to the MOH. They must register the company.
Right.
They must register the number of employees that they want to vaccinate, and then they will come to the Oman International Hospital. So we will be under these rules. So I can tell you that in the upcoming days, we will give the vaccine to more than 20,000 people inside the Oman International
Wow.
Hospital, which is remarkable.
It is remarkable indeed.
It is.
Which brings me to the question that executing this vaccination drive is going to take, of course, professionalism goes without question, but also precision and executing the plan. So tell me a little about the management of this hospital, Oman International Hospital, Ideal Med.
Yes.
So tell me a little about that.
Well, IGHS is based in Portugal, and we came to Oman in 2016, 2017.
The good old pre-pandemic days.
Exactly.
Yeah.
On the beginning of 2017, at the time we presented the concept for this
Right.
hospital. And then in the end of 2017, we took the decision to go ahead with the project of the hospital with the other two shareholders. So from one side we have IGHS, and then we have also Oman Brunei Investment Company. That was the company that took the first step to move with this hospital, and also Swail Bahwan Group, that is also one of the shareholders of the hospital. And since then, we have been obviously working as a company to guarantee that we will develop an hospital that it will be obviously different.
Right.
We have we respect as no one else our competitors. We know that they are already performing since ever in the city. So by that, we just want to show to the community what we are able. We need to prove that everything that we have been saying until now
Right.
is for real. So that's why we started now with this strong campaign regarding vaccination, showing that we are obviously able to give the vaccine to this impressive amount of people. That's why we are presenting a lot of new services inside the hospital. When, for example, when you see the excellency services that we have regarding some medical activity specialties, like the Ortho and Spine Center, the Mother and Child Center, and the other two centers, one for ophthalmology and the other for Heart Center. Those are obviously the result of not only the study of the needs of the population, but at the same time a joint effort with international teams,
Right.
with local teams. For us, we always say that when you combine facilities like the facilities that you have here, when you combine these facilities with the best medical equipment, and also with the excellent human resources,
Right.
you have everything to succeed. So Idealmed GHS was doing not more than this. We were studying the population, studying the needs of the local community, assuming the goals, raising the levels of the services that we want to provide, guaranteeing that this hospital will be obviously different. And when we say different, we are not obviously criticizing
Of course,
the
yeah.
services that are being
Right.
provided by any other hospital.
But I think innovation shouldn't stop. It doesn't matter what industry you operate in. For example, when you think of a restaurant,
Yes,
why is it that we can think of a million concepts,
yeah, for sure.
a different feel or the different experience or the different kind of foods? Why not a hospital take that approach and provide something different for
No
its
doubts.
customers?
No doubt.
It is indeed a fresh breath of air coming into this hospital, because generally what I've noticed, even me as a patient, when I go to a hospital, there's not much of architecture that's involved.
But if you look inside, you have examples. You have the food that we serve to our patients is part of the quality of the treatments that we are providing.
Right.
And that's why we are not professionals on preparing the food for the
Right,
patients. But we want to have the best with us. So we took the decision to make a JV with Kempinski to guarantee that they will be managing the quality of the food that we provide to all our patients. This is an example. We want to have always the best medical equipment inside. We want to have always the best medical teams inside and technicians inside. So we have an agreement with Siemens, a 10-year agreement. It's a long-term agreement, guaranteeing that we have a med academy inside that is fully sustained by Siemens, that will guarantee that we are able to train health professionals, not only for our own hospital, but also for other hospitals,
Right.
not only in Oman, but also for the region.
Right.
So this is also obviously a source of differentiation. And I can be here talking 2 hours
I
in
know.
sources of differentiation,
True.
because as you can imagine, we have obviously a lot of projects to implement inside, projects that we deeply believe, that we consider that are an opportunity not only for us, but also for the country, for the city, for the region, if you want. Because when you, for example, when you are talking about teaching, when you are talking about sharing experience, sharing knowledge, this should be seen also as an opportunity. It's an opportunity to develop.
Of course.
It's an opportunity to learn.
And especially in this industry, the medical
And
industry, the
especially in
more
this
you
industry.
progress, the better it is for the country that the hospital operates in. Like you rightly said, other hospitals trying to emulate the benchmark that they see in the region or even globally for that matter.
Yeah.
So on that note, I would like to wish you luck with all the future
Thank you
projects
so
for
much.
Oman International Hospital. It's a pure pleasure having you,
Thank
Mr.
you so much.
Alexandre
Thank you.
Cunha,
Thank you.
which I practiced 15 times before I went on air.
Perfect.
So pure pleasure talking to you. Good luck, and hope to speak to you soon,
Thank you so
inshallah.
much. Thank you.
And for you there, thank you for watching. I'll see you in the next one. There's Abbas Al Lawati signing off.
TFM. Let's talk.